Cheap dental implants, too good to be true? Maybe. Today we're going to talk about that. I'm Dr. McRee here at JAX Implants and Dentures in Jacksonville, Florida, and all I do is full mouth dental implants. So it's been a huge discussion that I've seen, and people ask questions constantly. They're like, hey, they're searching cheap dental implants. How is that possible? I'll just go ahead and start and say like, hey, what our average cost is here for a full set of implants. So an arch would be, a top or a bottom, 2 arches, obviously top and bottom. So it's about $20,000 an arch. Give or take, there's some situations where it might need zygomatics or some extra grafting. That's pretty rare, but that's just a good standard number. I would say industry standards has been coming down a little bit over time, but somewhere in that 22 to 25 range is from what I've seen. But I've seen as low as like 10 or 11. So I will get into, how is that possible? How am I double? Who's right? And how is that possible? So realistically, our office, that's not possible. And there must be some omission of some major steps. And I don't want to come across as accusatory or that they're doing something wrong. I'm not implying that, but it's not possible to do it the way we're doing. And so I don't think that's really an apples to apples comparison. And again, that's me saying it, so take it with a grain of salt. But if you look at our before and afters, you'll see I'll put our work up against anybody's. So some of the ways you can do it, I will say that we do everything in-house, so we don't even really pay a lot of middlemen whatsoever. So we really do pass a lot of the savings as far as that goes on to the patient. But to go basically half of that, I would say typically from what I've seen, one of the main ones that I've seen online is where they advertise that it's an all-in-4 or a full mouth implant, but what really they're doing is not giving you the final, right? So they'll do the implants, maybe not always well, but they'll do the implants and then they'll put in a temporary and they'll say that's final teeth. Well, those are not FDA cleared to be final teeth. Or potentially they're going straight to the final and then skipping temporaries. Well, that saves a lot of time and effort too. Reason being, at my clinic, right, I'm gonna make you a set of temporaries, and then if you want changes, I'm gonna make more. Well, that takes time and effort, right? I have a lot of well-trained technicians that have a ton of experience, which again, does take effort and time and costs us money, right? Because we have talented people here and you don't get good talent by paying low, pay. And obviously that does, come out with the outcome of where it's going to be a little higher, but it's also going to take a lot more effort. Well, if I skipped those steps and just went straight to final and say, hey, do you get what you get? Well, yeah, there's going to be a little bit cheaper, but that's going to definitely detrimentally affect the quality of what you're getting. And it is a big investment. So, and I'm not cognizant of the cost. I understand that's a huge barrier to most people, but I do want to be upfront of what goes into it. And it's not just, oh, we'll put in the implants and then see you later. Well, at least not here. Like I said, we maintain our implants for life. We have patients come back in every year. Like I said, we put a ton of effort and a ton of time in for a day of surgery. We will do anything necessary, any additional grafting, any sutures that are necessary, all the little small stuff, soft tissue grafting, all that kind of stuff, because if I'm doing it, I want to be built for life. I can't say the same when you're going for that low price. So I just want to throw it out there. I get it. If that's you're saying that's the only thing that's really in a budget for me, I'm not blaming somebody, I'm not shaming somebody. I don't want to make someone feel bad, but just understand what you may be getting into or what you may be, the outcome may be years down the road. And that's okay. If that's what, works for you, that's okay. Now I do want to touch slightly on the other side, right? We're around 20. I've had people come in with treatment plans for 40, 50, just an arch, not for the whole full, upper and lower, and it'll be up to 100. There's no way to say it. That's just absurd. I'm using the highest quality materials. We don't outsource things, right? We don't send stuff overseas. A lot of places do that. They'll have it fabricated overseas. They'll use off-brand parts and pieces and stuff like that to kind of shave off. We don't do that. And so if I'm not doing it and I'm using the highest quality and we have a ton of experience and we have everyone on site, that's, charging that much is kind of crazy. And the only reason I'm saying that is, and I'm not saying those clinicians are doing bad work, they're most likely not, but it's not necessary to pay that much to get the quality that you're looking for, to feel like you're being taken care of, and also having it done right. We have the experience here, so you're gonna get that, and so paying, double, triple that is just not necessary. So I know this is a, not maybe the most crazy informative thing, but at least wanted to give you a general sense of cost and what goes into making dental implants and on the back end, and then why something might end up being cheaper and why something might end up being more experienced. So now you have a general idea of what might be cheap, what might be expensive, and maybe what's right for you. So I'm Dr. McRee with JAX Implants, and this is what you need to know about dental implant cost.